Are you curious to know what is happening in the future with the Medicare Supplement Plan F? Stay tuned. Hello, this is Billy Williams, Medicare Health Insurance Options.com. Our phone number is 800-499-1942. The purpose of this video is to talk a little bit about what's going on in the future in regards to Medicare Supplement Health Insurance Plan Letter F. The Medicare Supplement Plan F has been a very popular plan for many years, but there are some changes coming in the near future. Back in 2015, Congress put into place a new law. It is called the Medicare Access and Chip Reauthorization Act of 2015, known as MACRA. There's a lot of different things addressed in this law, but the condensed version of the information that relates to this video basically states that anyone who turns 65 after January 1, 2020 can no longer get a Medicare supplement plan that has no deductible. What that means is if you have a Plan F or a Plan C, then the insurance company currently will pay your Part B deductible for you. I'm going to show a chart here of the current plans that are available, and you will see that on the Plan C and the Plan F, the insurance company is required to pay your Part B deductible. Now, the Plan C is not a plan that you're going to run across very often. It's very rare to see the Plan C, but the Plan F has been a very popular policy. So I want to explain kind of the backstory on this transition and give you my opinion that I really think it's not a bad thing. I really think it's a good idea. So let's just kind of start by explaining a little bit of a backstory to Medicare and what's happening. Now, anyone in America that's born between 1945 and 1965 is considered a baby boomer. I'm towards the end of that spectrum. I was born in 1959, but there are a lot of baby boomers in America. Right now, on average, every single day, there are about 10,000 people turning 65. So obviously, the governing authorities that oversee the Medicare system, they know this and are trying to take some steps to make sure that long term the Medicare system does stay financially stable. The reason it's a concern is because that's 10,000 people that yesterday were paying into the system, and now they crossed over the fence, so to speak, and now they're wanting to take out of the system. There's already been a few steps that have happened. One thing is that the premium that an individual has to pay for Part B of Medicare has went up a little bit. Some of the deductibles have increased. The Part A deductible has increased. The Part B deductible has increased. So these are a few steps that have been taken already. Another step is to do away with any what we call first dollar coverage plans that pay the first dollar on every single medical bill. Now, if you're like me, I don't like going to the doctor, and I won't go unless I'm pretty sure that I need to go. But you might know some people that don't mind going to the doctor, even maybe like it a little bit. So a person that has a Plan F, they know that they can go to the doctor anytime for any reason, and it's not going to cost them anything. It's free. So if you took that same person and you put them on a plan, let's say, for example, a Plan G that does have a deductible. Right now, if you had a Plan G, your Part B deductible is going to be $183. If you had a person on a Plan G and it's the beginning of the year, they're thinking about going to the doctor, they might pause, at least momentarily, and think about it and come to the conclusion that they have not met their Part B deductible yet, And so if they went to the doctor today, they're going to have to pay some money out of pocket to do that. And so they decide, I don't really want to go pay money to see the doctor. They wait a few days and they're okay. So there's a little bit of psychological deterrent built in to prevent overuse in plans that have at least a small deductible. So the way this law is going to work is this. If you have a plan F now, you can keep it forever. Even between now and the end of 2019, you can still purchase a plan F. However, this is not a good idea. It's actually a good idea to go ahead and transition over to a different plan letter sooner than later. And here are some reasons why. We've actually been recommending to many of our customers over the last several years to move away from a plan F to a plan G, even before this announcement was made. We have noticed over the last number of years individuals that we have moved from a plan F to a plan G in the future when there are rate increases. The percentage of rate increase on a plan G has been almost always a smaller percentage than those that remained on a plan F. Basically, because of the deductible, the claims are less for the insurance company. Therefore, the rate increases on the premiums are more manageable and more reasonable. So if you were to stay on a plan F and no new people were able to get that plan F in your area, that is no longer going to be a good thing for you, especially if you understand how the whole system works. So whenever you get a Medicare supplement policy with any company, you're added to a group of people. The group that you join is decided by where you live, what plan letter that you choose, and what insurance company that you decide to use for your coverage. So when you join a group, everyone in that area, in the same group, you share risk. There is a law that states that every insurance company has to have specific records for each group. The insurance company calls it a block of business. They're required by law to maintain a minimum ratio, 80% premiums to claims. So basically what that means is for every $100 that is paid in to your group, the insurance company must pay out at least 80% in claims. So they will report these numbers to the insurance commissioner in your state each year. They're going to stay as close to that 80% as possible. If they can show that they have been paying out more than 80%, they're going to request permission for a rate increase, and then your rate goes up about once a year. Now, if you're on a plan F that is an active block of business, that means there are still people joining, then basically through time, some people join your group, some people leave your group. And when you have people joining your group, you really hope that they're healthy people, right? If you have a healthy person join your group, that's good for you because they're going to pay into the group, but they're not going to take out so much, so that's good for you. If you have an unhealthy person join your group, that is not good for you, but that's basically the way health insurance works. Now, if a plan F that you're on, if the group that you're on can no longer accept new people, there's only thing that's going to happen is people are going to be leaving. So no new people can come in. So basically what happens if you are on a closed block of business, healthy people start leaving your group, and the people that are still there by far are the unhealthy people, and your risk pool is a higher risk pool. The claims go up overall, your rates go up overall, and you're going to see faster, larger, more rate increases on your plan F. So to recap, a law has been passed that starting in January 1, 2020, no new people can get a plan F. If you have a plan F now, you can keep it forever. However, it's probably a good idea to consider getting off of plan F at some time in the near future. And there are going to be some good options for you. A couple of good ideas would be either a Plan G or a Plan N. I'm not going to go into a lot of details about those specific plans in this video. We do have some more videos on our website and our YouTube channel that talk about these plans. However, if you are curious about your options, please give us a call. We are an independent agency. We specialize in the senior market. Our services are always free to you. We would be very happy to look at your current coverage and see what your current premium is. Compare that to a Plan G or a Plan N, explain the difference, explain your options, and assist you in making a change if you feel like that is something that you would like to consider. Again, our website is MedicareHealthInsuranceOptions.com. My name is Billy Williams. Our toll-free number is 800-499-1942. Thanks.